morning, guys. My name is Ernesto Nobleas. I'm your Director of Environmental Health and Safety. We're going to be speaking for the next 15 minutes or so about the workplace safety strategy that we put together with the help of the executives when it comes back. Thank you very much for taking some time out of your busy days to come here and talk with us about the workplace safety strategy. Now, one of the things that we need to mention is that when it comes to the workplace safety strategy, it's being put together and presented by Chrissy Miller, our Employee Health Manager, and yours truly, Ernesto Nobleas, the Director of Environmental Health and Safety. Now, there's a couple of things that we're working towards when it comes to the workplace safety strategy, and a lot of the new things that we're doing as part of our efforts in 2019. All of it is working towards a tenet and a vision. Now, that tenet is that an injury-free workplace is an essential ingredient of high-quality, affordable patient care and to being a best place to work. Now, the executives have put together our vision, and that vision is being achieved through 4 work streams, specifically in leadership and employee engagement, safety management systems, risk reduction, and performance management. Now let's talk about the people, leadership and employee engagement. What this is trying to say is that every single person in Maui Health System, every part of the org chart, that they all have a responsibility when it comes to workplace safety. So looking at it from the org chart perspective, the executive leaders have defined a more specific vision for us, and that is the Maui Health System will provide a safe working environment where all employees carry out their duties free from harm. And what they're saying is that they want you guys to be able to clock out from work just as injury-free and healthy as you clocked in from work. I don't like getting injured on the job, and I'm sure you guys feel the same way, right? Yeah. So the executives have defined this vision for us, and it's their responsibility to empower each and every one of us to be able to work towards that vision. Now, managers and supervisors, what's their job when it comes to workplace safety? It's to understand the high-risk areas and tasks in each of the departments, to create and maintain a safe environment for you guys to work in, and then to address unsafe conditions and behaviors in a timely manner. Now, the next role, safety professionals. Specifically, when we're talking about the safety professionals, we're talking about members of the Workplace Safety Committee, like Chrissy Miller, our Employee Health Manager, or myself. And our job is to serve as an additional resource for all levels of this engagement, for each of the departmental employees, for the supervisors, managers, for the executives. If any of those people have a question about how to address workplace safety, whether something is a hazard or not, or how to mitigate or deal with that safety hazard, we are here to serve as an additional resource for that. Now, employee engagement, the engagement of all of you, of the departmental employees, is the mission critical part of all of this. We can't do any of this without you. Our hope is that you guys can serve as our eyes and our ears, that you guys are out there actively identifying safety hazards that you see, that you're working with your leadership, that you're engaging in these safety huddles, in incident investigation and analysis, so that we all can be working together towards a safer workplace. And then that engagement also is through safety communication. That's being able to talk back and forth between all of these levels about safety, about identified hazards, etc. So, after talking about the people, we're also going to talk about the processes. Now, safety management systems are the processes and procedures that either are in place or going to be put in place as a part of this workplace safety initiative. One of the newer ones that we have, that we're about to be putting in place, is job hazard analysis. And that is one of the ways where we take a job role and the tasks and responsibilities that are assigned as part of the operations of that job role, and we seek to determine where there are high-risk tasks, and then minimize those risks. For example, if we're looking at it from a hazardous materials perspective, if there was someone in here that works at the lab or in pharmacy, it's a high chance that they're working with hazardous materials as part of their day-to-day job. So we need to make sure that they're working with the appropriate PPE, that we have the appropriate spill response procedures and equipment, and if there's some kind of exposure, that we have the appropriate first aid measures to be able to help them through that exposure. And that's just the hazmat part of the job hazard analysis. Speak up culture. Now, we already have a great speak up culture when it comes to ethics, but one of the things that we're going to be further cultivating in 2019 is a speak up culture for safety. And that is that if you feel like your team is about to start a task that you feel is unsafe, that every single one of you feels comfortable speaking up about it, putting a pause on where that process or procedure is, whether it's started or not, or if you're in the middle of it, and saying, hey guys, I have some concerns, can we address this as a team? Joint labor and management safety structure. This is talking about empowering every single one of you to identify safety hazards, to address it, and then to address it primarily with your supervisor and manager. To say, hey, Mr. Supervisor or Mrs. Supervisor or Manager, this is an issue. Like, I think that this is a fall hazard, or we need to have a better process in place when it comes to safe patient handling, et cetera. And working, and then further empowering that supervisor or manager to get the resources that are needed in order to address that safety hazard. Whether it be working with another department in the hospital, or even escalating into administration. And then incident reporting and analysis, that we're doing accurate incident reporting. We already have the UOR and SFR and other incident reporting processes in place, but we need to make sure, guys, that these reports are not only timely, but done on every single incident, because if we don't have good data, we don't know what we need to work on. Does that make sense to you guys? Perfect. And then safety training and development. There are programs that are in place, and then there's going to be more programs in place when it comes to building safety skills among staff to focus on hazard identification and mitigation. Now moving on, we're going to talk next about risk reduction. And this is about identifying potential hazards ahead of time in order to either decrease their frequency or probability of occurring, or to lessen the impact if they still occur anyways. For example, for hazard identification, assessment, and risk reduction, one of the ways that we're dealing that is with the use of needles in our hospital. And we're looking at it from a very programmatic perspective. We're looking at the actual needle products themselves to make sure that they have the appropriate safety features, whether it's an active or passive safety feature. That we're looking at the process around the use of that needle to make sure that you have an appropriate disposal site close to where you have a high frequency of use of those needles. That we're looking at the competencies and trainings to make sure that if there's a new device that's introduced, that you guys know how to use it, how to activate the safety feature if it's an active safety feature, et cetera. Ergonomics, that there are as many different types of configurations of workstations as there are body types. So we want to make sure that your workstations are configurable for you so that they're not giving you undue neck strain, back strain, or even eye strain. And then safe patient handling and mobilization. I'm sure every single one of you guys has been involved with moving a patient into, out of, around, or to the side of a bed. And you know that not every single patient is going to be 80 pounds and fully ambulatory, that it could be an effort. So looking at that programmatically as well to make sure that you guys have the appropriate equipment, process, training, personnel even, in order to do that both safely and effectively. And then slip, trip, and fall prevention, that we're minimizing the number of, or the potential for falls in and around the campus of Lanai Community Hospital. That we want to make sure that we're minimizing the number of falls that happen, and not just with our patients, but also with our visitors and fellow employees. And then performance management. Anytime that there's this rollout of a new strategy or initiative, guys, we want to make sure that it continues to be effective. And the way that we do that is we look at these performance indicators. Now, one of the performance indicators you guys may have been hearing before is like how many workplace injuries have we had over a set period of time, like the last month, the last quarter, the last year, et cetera. But what we're doing is we're doing a more in-depth analysis of this in order to understand what was the mechanism of injury, where did it occur, what kind of competencies or trainings did that employee have up in the lead up to either that actual injury or near miss of an injury, so that it can paint a fuller picture of where our workplace safety strategy is being effective, or where it needs to be edited in order to keep it sustained and make it more effective for you guys. And that's my presentation. I'm hoping it was an effective use of your guys' like 14 minutes. But like honestly, this is the first part of the rollout of this workplace safety strategy. As you may or may not have heard, this is like there's a 30, a 60, and a 90-day plan But the most important thing to tell you guys is that there's gonna be a lot more coming over the next couple of months. And there's gonna be more information, more training. So I know that this was a lot of information up front, but there's going to be more coming down the road, further involvement with every single one of you, and I look forward to working with all of you on